The CDC reports more than 150 people die every day from overdoses related to synthetic opioids like fentanyl. Idaho leaders say it's a growing problem here as well. In fact, Governor Brad Little created Esto Perpetua, which is a task force dedicated to stopping the drug flow into Idaho. Our Tristan Lewis joins us now with how health leaders are getting the ball rolling with education and a look at the tools available for Idahoans that could help save lives. Tristan.
Shira, Central District Health puts together classes that focus on overdose prevention and response efforts. First responders primarily attend the class, but it has teachers and home health care nurses too. The instructor emphasizes anyone can take part in it because of how crucial this knowledge is. With Idaho's fentanyl-related overdose death rates rising year by year, health leaders in the Gem State are looking to help save lives by spreading community awareness of tools available.
Everyone needs this training because no one knows when an emergency like this could happen.
Courtney Boyce is a health education specialist for Central District Health's drug prevention program. She travels around the 4 counties CDH serves and teaches people about substance use misuse, prevention, recovery, and treatment.
It's improving our community capacity to be able to address these types of emergencies while also empowering family members and friends to know what to do in case something happens.
Part of this training teaches people about naloxone, which is a medication that reverses an opioid overdose. According to Boyce, an overdose can slow down a person's breathing and, in some cases, even stop it altogether.
It kicks the opioids off of those receptors and takes its place for 30 to 60 minutes.
Boyce says many overdose cases are unintentional. She says law enforcement and health departments are seeing fentanyl being repackaged to look like legitimate prescription medication and combined with other drugs like heroin and meth.
And it only takes a little bit to be fatal, so they could potentially have an opioid overdose, even if that wasn't their substance of choice.
Because of this, Boyce says it's an important lesson and tool everyone should have, even if someone doesn't take medication.
It's the same as having a fire extinguisher in your house.
And because of how small the nasal spray is, she urges people to have it on hand at all times.
And we're seeing a lot of law enforcement officers carrying it now, which is great, because we're seeing more reverses as a result.
Now, naloxone is free to everyone through different organizations and agencies like the Idaho Department of Health and Welfare and the Idaho Harm Reduction Project. Boyce says people can also pick up the medication throughout Idaho pharmacies, and anyone can also request Boyce to host a training for their group or business on overdose prevention and response. Tools like naloxone will be provided as well. And for more details, you can visit our website, ktvb.com. Shira?
You know, Courtney mentioned it, but you just never know when an emergency like this can happen. So a lot of good information there. Exactly. Thanks, Tristan.